Coming up next on It's Personal, well, it's springtime and time for you to get moving. You're going to learn more about Minutes in Motion. And oh, by the way, it's free. Colonoscopies, are you due? March is Colon Cancer Awareness Month. You're going to learn more about that. And a little bit later, the Stop the Bleed campaign is underway, and the aim is to have more tourniquets, in fact, tourniquets in all of the AEDs within the area. You're going to find out why. All next on It's Personal, brought to you by Gundersen Health System.
Nobody likes having blood drawn, especially kids. But Lisa has been a Gundersen Health System lab tech for over 20 years, and she's learned a few tricks to help ease the pain.
When I first started, another tech taught me a secret that's won me a lot of points with my younger patients.
Hey, Bunny!
The hand-drawn bunny bandage, made right in front of the kids so they can see it's just for them. I have some multicolored markers so that the bunnies can even match their outfits.
Little things like this are what make Gundersen different from the rest, providing extra care where it's needed most through all stages of life. We call it love plus medicine.
If I can help them through a scary experience with a simple explanation, a bit of encouragement, and a gentle touch, that's it. I've done my job. Then I top it off with a bunny bandage.
Thanks!
Next time I see them, my face might be a little more welcome.
Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org. Gundersen, where caring meets excellence.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Christopher. Minutes in Motion has been active in the community, well, actually several communities, for now over a decade. Joining us to talk about that is Carrie Zimmerman, Wellness Education Specialist in the Community and Preventative Care Services Department at Gundersen Health System. That's a mouthful. Thanks for joining us.
Thank you.
Let's talk a little bit about Minutes in Motion first of all. It's a community-wide effort to get people out.
Yeah, so anybody, anywhere can participate, any age, any ability. It's just we really want to get everyone active for 30 minutes a day.
Why? Why 30 minutes a day?
30 minutes a day is just the basic standard to improve your health, improve your physical activity, and just to get people moving.
A lot of times people think, oh gosh, Carrie's going to try and get me out on the treadmill, or as some people call it, the dreadmill, but that's really not what you're looking to do. 30 minutes of activity is just that, it's activity. Can you talk about what that means?
Yeah, so you don't need to be going to the gym for 30 minutes a day. You don't need to be running. It's just anything you enjoy. So you can walk your dog, you can work in your garden, housework, yard work. Anything that's just getting you active.
It's to get off the couch a little bit.
Exactly.
So Minutes in Motion, this is the 12th year?
This is the 12th year.
The idea is to get people out and moving, and it's to create a healthier population, right?
Correct. So the obesity rate keeps rising, and the best way to go about that is just getting people active. People are on the couch a lot of the time. We work, and we sit while we work. We sit while we commute.
Yeah.
So just helping people get active is just starting with that 30-minute mark and as that minimum.
And then the idea is to track that activity. Can you tell us about how that works?
Yeah, so you would go on our website, gundersenhealth.org/MIM, and track your physical activity on our wellness portal. You can track daily, weekly, or all at the end of the challenge. We are doing prizes for those who track weekly. So if you meet the minimum goal of 210 minutes a week, you don't necessarily have to do 30 minutes a day. But as long as you're getting that 210 minutes a week, you can be eligible for weekly prizes.
Now, what a lot of people don't know is that Carrie and I have been emailing about some people that have done this in the past. You've shared some information about some teachers who are getting their students involved. Why is that important, and how are teachers able to kind of get their classrooms involved in Minutes in Motion?
So kids are at school almost more than they're at home. So a great way to start is just with the teachers and the students. So teachers can register their classrooms. They just sign up online, enter the number of kids they have, and at the end of the challenge, they enter the total number of minutes. And then we have 10 gift cards to give away to those teachers. So they'll all be putting to a drawing, and they can win $100 for their classroom.
So this is year 12. It's been a successful program, and it's not just for the La Crosse area, but it's really kind of gone nationwide. There's teachers that do this in other locations, not only in Wisconsin and Minnesota and Iowa, but even individuals doing it as far away as Portland, Oregon.
Yeah, we have people from all over the United States doing this. We've had international participants in the past. We have a group in Oklahoma getting up to do this year, so we'd really like to see it expand throughout the nation and everywhere.
Sounds great. We're talking with Carrie Zimmerman, Wellness Education Specialist through CPCS, which is Community and Preventative Care Services at Gundersen Health System, about Minutes in Motion, the program, the sign-up underway starting March 1st. How do people sign up? You mentioned the website, gundersenhealth.org/MIM.
Yep, so you can go to our website. All the information will be there, so you can sign up and get started.
All right. What are the goals for 2018? Now, I know this will run essentially, the program itself starts on Easter Sunday.
Yep, so we start April 1st. We really want to hit 8 million minutes this year, so everybody is encouraged to put in those minutes. We have prizes going on for registration. So every 1,000 people that register, we're going to do a drawing for a $50 gift card. So the earlier you register, the more chances you have to win. Get all your friends and family to register as well, and that'll help you increase your chances to win.
We really like those prizes, that's
do.
for sure. And all through the month of March is when the registration is occurring.
Yep.
And the program itself, when you start tracking your minutes and that kind of thing, starts on Easter Sunday and it ends on Mother's Day.
Yep.
All right, so right through the early part of May, it sounds like a great opportunity to get out there and get active this spring.
Yeah, absolutely. And you can register. Registration doesn't close. You can continue registering all throughout the challenge as well.
What other things should people know about Minutes in Motion? What are the key things that they should know about Minutes in Motion and why they should sign up?
So you should sign up just to get active. It's a great motivator. There's chances to win. You can form a team with your family or your friends or your coworkers to help encourage everyone to get active. And it's just a great way to kick off the spring season.
What about other groups that should be considering signing up for Minutes in Motion?
So work sites are a great place to start. You can register with your coworkers and motivate each other that way. We're also encouraging assisted living facilities to register. So kind of hitting that other population of those older adults who maybe think that this might not be a great program for them, but it really is. All ages, all abilities can participate, even if it's a chair exercise or anything small where you're getting moving.
Is it better to try to motivate through group activity?
I think it depends on the person. Some people are motivated on their own and they'll just go about it by themselves. Other people really want that social support and other people to get them motivated.
Yeah, when you know somebody else is going to be waiting for you to do that activity, it does make it more consistent, if you will, to get there and actually do the activity.
Yeah, absolutely. If you have a partner or a friend who is waiting on you to go for that run or that walk or whatever it might be, it's harder to skip out on that.
The other thing that we need to mention is that Minutes in Motion is free.
It is free. So there's no cost to participate. All the benefits are just improving your health, and you can win prizes from participating.
And again, we all like prizes.
Absolutely.
Now, I know this is your first year of running the Minutes in Motion program. Excited, scared, nervous, what?
A little bit of everything.
Yeah.
So I'm super excited to get going this spring. This is my first year with Minutes in Motion. So I'm hoping to bump up our participation a little bit and see what we can do.
I bet you get some family members that are probably going to be encouraged to
definitely.
sign up. All right, Carrie, thanks for joining us. We really appreciate it. And good luck with your first year of Minutes in Motion.
Thank you.
Hope to talk with you more as well. Carrie Zimmerman, Wellness Education Specialist at Gundersen Health System. And sign up for Minutes in Motion. Sign up right away. It's on the website, gundersenhealth.org/MIM. And when we come back, we're going to talk about colonoscopies. Are you due for a colonoscopy? March is Colon Cancer Awareness Month. You're going to learn a lot more when It's Personal continues. It's Personal is brought to you by Gundersen Health System.
This is Nancy, and this is the first time she's been outside in days. She's been rehabbing at Gundersen Health System, and now she's relaxing comfortably in bed, outside, on the patient terrace.
I'm an outdoor person, and I really missed getting out. I'd sometimes ask the staff to wheel me the long way back to my room after having tests done, just to see something different. Then one day they asked if I'd like to go outside. I thought they were joking.
Having a bed outside the hospital is not usual protocol for the staff at Gundersen, but sometimes a little more personal care is needed.
I'm parked in the sunshine with fresh air, and I think that bird is a goldfinch.
At Gundersen, we believe when a patient is as comfortable as possible, more is possible, and that love really is the best medicine.
Nope, it's a cardinal.
Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org. Gundersen, where caring meets excellence.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Christopher. It is Colon Cancer Awareness Month, and we're going to talk more about colon cancer and maybe the demographics around who should be getting a colonoscopy. Joining us to talk a little bit more about that is Lisa Pisney. She's an RN and an NP at Gundersen Health System in the gastroenterology department. Thanks for joining us.
Thank you.
Colon Cancer Awareness Month is each March and always on one of the first Fridays in the month. There is a day where everybody wears blue. Now, it hasn't been super popular, but more and more people are understanding the importance of screening, the importance of colon cancer awareness. Where would we like this to go and why?
Well, we'd like everyone that's eligible for screening to be screened, and the aim for 2018 was 80% in 2018. Colorectal cancer is the third most common cancer diagnosed in the United States and the second most deaths from cancer in the United States. So we think it's really important that everyone that needs to be screened. And typically, with no history, you should start screening at age 50.
At age 50. And is that men and women?
Men and women. There are some studies that say African Americans should start screening at age 45, and it changes if you have a family history of advanced polyps or colon cancer, especially in those who have a relative under the age of 60. They should get screening about 10 years before that first relative was diagnosed.
So let's face it, Lisa, we're talking colonoscopy here, and it's just not popular.
Well, there are several tests that can be done for screening, including FIT testing, which is a fecal test that looks for blood in the stool. There's also a fecal DNA test. There's sigmoidoscopy, which is a shorter version of a colonoscopy. There's CT colonoscopy. So there are options, but the best test is a colonoscopy, of course, because we can go in there and remove polyps, and we know polyps are the thing that causes colon cancer.
Is this the kind of thing that's covered by insurance? I mean, you hit that age 50. How do you find out? Do you just have to know that you're supposed to go in at age 50? That's the screening time?
Usually your primary care will mention that to you at age 50, and all insurances, including Medicare and Medicaid, will pay for screening at age 50 with no history, and then of course that earlier screening if there is a history. The thing to know about those other tests like FIT testing or DNA testing is they have to be done more often than a colonoscopy, and once you have a positive test, then colonoscopy is the next option. The one thing about insurance is that when you do a FIT test or another test for screening, once it's positive, your colonoscopy is no longer screening but diagnostic, and so you may end up paying your copay for that.
Very interesting. Now, again, we're talking with Lisa Pisney. She's an RN, NP in gastroenterology at Gundersen Health System about colon cancer, really, and that's the concern. The concern, I guess, for a lot of us is what do you find when you're age 50? What are you looking for? Obviously colon cancer, but there's other warning signs. Am I correct?
There are, but colorectal cancer, colon polyps typically don't have symptoms until late in the disease process, and that's why we screen the population for that. FIT testing looks for human blood because larger polyps can bleed, but it's usually those larger polyps. At colonoscopy, we can remove smaller polyps and larger polyps. We know that the larger the polyp, the more chance of dysplasia or cancer. But it's nice to get those smaller polyps removed because then you can have a longer time between episodes of screening. So colonoscopy is recommended every 10 years if no polyps are found.
Now, I'm probably oversharing here, but in my family, there's a history of finding polyps. So is that something that people who have that in their family should be going in for much earlier? How early?
Usually it's the about 10 years before your first-degree relative was diagnosed with a polyp. So if your dad had a colonoscopy at age 50 and he had polyps, then you should have a colonoscopy at age 40. It does depend on the age at discovery. So if you have first-degree relatives that are above the age of 60 that have colon polyps, then you can wait until age 40 to have your colonoscopy.
Now, I've been lucky in the fact that my uncles have shared this information with me and have passed that on. How do you bring this conversation up about family history to loved ones?
Yeah, that is something that people will often say to me is like, we really don't discuss that. Certainly if there's cancer in the family, most people will know about that, but they don't ask about polyps in their family. But when you're nearing that age or when your father or mother have a colonoscopy, it's important to ask them, did they find polyps at your colonoscopy?
Let's talk quickly because one of the reasons that a lot of people don't get the test done is they hear about it. Mm-hmm. They hear this is a colonoscopy and they find out that this is invasive, if you will. Can you talk us down from that a little bit?
So I think the biggest complaint most patients have is that the prep that they have to take beforehand. The procedure itself is really not that bothersome to the patients. We do sedate patients for that, and typically they don't even remember they had the procedure done. But the prep, you're on a clear liquid diet for 24 hours, and then you begin drinking these gallon jugs of Go Lightly to clean out the colon. And, that's uncomfortable for some people, but some people tolerate it great. We do have suggestions about how to make it more palatable for people. And if you only have to have it done every 10 years, that's not so bad.
And the benefit is finding, polyps or
Yes.
colon cancer early.
Yeah, so we know that we can prevent colon cancer in people that have colonoscopy. And all you have to know is one person that's had colon cancer and seen them go through that and makes you realize how important it is to have your screening done.
Well, Lisa, we're out of time, but thanks for joining us. And again, if people want to find out more about whether they should be going in to get a colonoscopy or some other test for colon cancer, talk to your provider.
Absolutely.
All right. Again, Lisa Pisney, RN, NP, gastroenterology at Gundersen Health System. You can learn more about colon cancer and colonoscopies right on the Gundersen Health System website. That's gundersenhealth.org.
And when we come back, the Stop the Bleed campaign is underway, and its goal is to have tourniquets, of all things, in all the AEDs within the area. We're going to find out why when It's Personal continues. It's Personal is brought to you by Gundersen Health System.
Let's face it, when you've been in labor for 24 hours, you're not exactly pleasant. And it takes a really special person to guide you through. For me, that person was Missy.
Fabulous. You're doing great. You're doing great.
She was with me in the hospital at Gundersen her entire shift, and somehow she managed to keep me laughing. She never got irritated with all my questions and treated me like I was the only person who mattered. It's weird, but I felt like I'd known her for years, even though we'd just met.
Here we go. And...
Missy is an amazing nurse. And because of her, I am a very happy first-time mother. And she's why I'm taking classes in the local college nursing program.
Gundersen Health System uses the power of love plus medicine, making each patient experience as amazing as possible. Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. There's a new campaign out. It's called Stop the Bleed, which sounds very severe, by the way, Tom. Tom Carpenter is joining us. He's a paramedic with Gundersen Health System. Thanks for being here to talk about the campaign.
Thanks for having me.
Stop the Bleed sounds serious. What is the campaign?
Well, it's a federally regulated campaign that they came up with all the stuff that's going on in the United States and in the war zones and stuff like that.
You're talking about like mass casualty
Mass
events.
casualties, different kind of weaponry, explosive devices and stuff. They're seeing a lot more serious injuries that, have a lot of bleeding, and the bleeding is the number one thing that kills people that's preventable. And so this campaign is designed around to teach civilians what to do until help arrives, because in those same situations, it might take a long time for help to arrive.
So we're talking about things like tourniquets.
Correct.
Talk about what a tourniquet means when it comes to saving a life, and whether it's a mass casualty event or an industrial accident, and why having the proper tools close to hand is important.
Well, a tourniquet is one of the devices in this training. We teach a couple different techniques, but the tourniquet is something that's easy to do, easy to use, and it stops bleeding without a whole lot of time being taken. And it can be put on even by the victim themselves in most cases, and it will stop the bleeding, most of the time, and it doesn't take any medical training or knowledge at all to put one on.
As a paramedic, you've come across scenes where tourniquets have been put in place.
Correct.
Oh, they save lives.
Oh, yeah.
Talk about, maybe give us an example of coming on an accident scene, a car accident scene, and as a paramedic, what you would do to put that tourniquet in place, and why learning how to properly do that is so important.
Yeah. Well, one of the reasons it's so important, if someone has a really severe bleeding from a large artery, for instance, it would only take a matter of minutes for them to lose all of their blood volume, and you can't survive without blood volume. So the quicker it gets put on, the better. And so commonly in my profession, where we see it is going to be industrial accidents or car accidents, car pedestrian accidents are very common, and then of course gunshot wounds, knife wounds, things like that, lawnmower injuries, where a tourniquet might be necessary to be used.
Now, a lot of people would say, well, isn't there something I could use around the house as a tourniquet while I'm waiting for the paramedic to be there, to get there? And a lot of people would say, you just put it on, tightly. I think where it comes into play many times is people think of it as a snake bite, that you put a tourniquet on in a snake bite situation.
Right. No, what we recommend is to not use a tourniquet unless you have a commercial device. And the reason why that's so important is because these are designed especially to not cause further damage. And so it has to be a certain width, it has to be a certain kind of material, and then it has what we call a windlass thing on it, so you tighten it up and tighten it up and tighten it up until the bleeding stops. And it's simple to apply, simple to use, but it's also safer for the patient or the victim to use that commercial device. And so when we do this training, we teach you what to do if you don't have a commercial device available.
Let's talk about that training, because training is important. As a paramedic, you see that all the time, that people think that they can just do some of these things, but proper training is key.
Yes. And the training is very simple. It doesn't take very long, but it's just the important steps. And, we talk about, the very first thing is just talk about how do you make yourself safe? What do you have to think about when you go to one of these incidents? And then, just to recognize the bleeding and where it's coming from, how to expose it, and then whether or not to use pressure or packing versus a tourniquet. And so that's all part of the classes when it's appropriate.
So there's a couple components here. We are looking to get training out to the public.
Correct.
And you're going to have to look for different ways that that's going to occur by going to the Gundersen Health System website. But there's also the component of not just the training, but it's getting these tourniquets out into the community. What's going on there?
Well, there's a lot of different things. There's lots of agencies that are working on it, rural hospitals, in-city hospitals and things like that. Ambulance services, fire departments, first responders all have the ability to get some of these kits out there in the public areas. Our goal is to get them with every defibrillator out there, every automatic external defibrillator, and get them in industry and things like that where they're easily accessible.
And then have that training that goes along with it.
Correct.
As well. So what's in this kit?
In the kit would be a tourniquet. It will have in there, depends on where you get the kit. Locally, there will be a scissors in it, the tourniquet will have a trauma bandaging in there for embedding into wounds to help stop the bleeding. And it will have, a pair of gloves so you don't get your hands all full of blood and things like that.
Okay, so obviously several different layers, and then how to properly use that kit is important. Now, from what I understand, Tri-State Ambulance is going to be trying to put on some public sessions on how to use these kits, but more importantly, getting these kits out into the community initially is what the goal is.
That's correct.
All right. How are you going to do that? Are you looking for individuals to be contacting Gundersen? Are you looking to get that information out in what way?
I think probably the best way is to go through Gundersen, and then they can direct you into, depending on where you live and what resources are available in that area of how to get the equipment.
Now, you're teaching these classes. What are you learning at these classes from the public?
What I learned from the public is, most people have kind of a general idea of what to do, but they don't know the correct way to do it. They heard of the word tourniquet before. They put them on, and in the old days we would see people use like tree branches and hammers and whatever to tighten up the cravat that they put on their extremity. In real life, most bleeding stops with just direct pressure, but, so we're talking about the really bad bleed. So what we're learning in the class is that the people really don't know the difference between minor bleeding and severe bleeding. But again, there's really good videos that come with the class that kind of show examples, and it helps them know, not to put a tourniquet on someone's cut finger, but to put it on the really serious ones.
Again, more information about these classes is going to be available online on the gundersenhealth.org website. But at these classes, about an hour long?
Yep.
Is that what it takes? Is generally an hour long, depending on class size?
Yes. In the class size, we will, if it's more than 8 people, we add more instructors. The lecture all can take place in one part, but then there's a hands-on portion where we have you actually put tourniquets on some mannequins or on each other. Just don't tighten them up. And then there's in that hands-on portion, we have one instructor for every 8 students. So it doesn't take very long to get everyone through.
So demographic-wise, who are we looking to have come to these classes? Anyone, or would it be better to have, I'll say, somebody from a manufacturing company? Are we looking for teachers to be there? Are we looking who should be coming to learn about the Stop the Bleed campaign?
Everybody, kids, adults. Just because you don't know where these things are going to happen, and you don't have a lot of time wait for people to get there. And so everybody should take the training. It's just like CPR training in a way. So we encourage everyone to do it. Some of the videos are a little graphic, so I wouldn't recommend it for really little kids, but high school kids and stuff would probably be good to take it.
All right. We're talking with Tom Carpenter, paramedic, Gundersen Health System, about the Stop the Bleed campaign. Are you seeing good results? Are you seeing, lots of interest? Or is this so early in the campaign yet that you haven't been able to really kind of get a feel for what the campaign's like?
Well, it is pretty early, but we are seeing a lot of interest with the ALICE classes going on. That's a big question after ALICE classes is, okay, now we know how to do when an active shooter comes in your building, but then what do you do with the people who end up getting injured? And so this kind of can go hand in hand with that. And once people know that it's a short class, everyone wants to do it. And there's no test, and that takes away the fear from a lot of people.
And again, more information on the Gundersen website. Tom, we're out of time, but we certainly appreciate your time, and good luck with the campaign.
Thank you.
All right, Tom Carpenter, and paramedic, Gundersen Health System. If you want to learn more about the Stop the Bleed campaign, go to the Gundersen website, gundersenhealth.org. And that wraps up this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer.
Dear Gundersen, my mom told me to write a thank you note for the cool bicycle helmet you gave me for free. It's the same color as my bike, which is mostly blue and some green. I like to wear it so if I crash, like my friend Charlie, I won't get stitches in my head. Charlie said stitches hurt a lot. You're nice. From your friend, Jeremy.